When an elderly patient fractures their hip, surgeons face a critical choice. Replace the entire hip joint with a total hip arthroplasty, or use a hemi-arthroplasty that replaces only the ball of the joint. A new study comparing these two approaches specifically looks at clinically important benefits rather than just statistical differences. The findings are meaningful. Total hip arthroplasty produced significantly better functional outcomes, higher patient-reported quality of life, and greater mobility at 1 and 2 years compared to hemi-arthroplasty. The differences were not just statistically significant, they exceeded the threshold that patients can actually feel in their daily lives. That is the distinction this study emphasizes. However, total hip arthroplasty is a more complex operation and not appropriate for every patient. For medically frail patients with limited life expectancy and low functional demands, hemi-arthroplasty remains a reasonable and less demanding surgical option. The takeaway: for active, higher-functioning elderly patients with hip fractures, total hip arthroplasty appears to offer clinically meaningful advantages. If you or a family member faces this decision, ask your surgeon whether total hip is on the table based on your specific health status and activity level.